Let's bring back our guest host, Peter Diamandis, XPRIZE founder and executive chairman, with a special guest, United Therapeutics founder and CEO, Martine Rothblatt, who is focusing on the future of health and medicines delivery now that we've got SiriusXM all squared away. And I'm now, I swear by, I don't swear at it sometimes, actually, if I go under wet trees. But it's hard to imagine. You are really a renaissance woman to go from Sirius to this. But initially it had to do with your daughter. You started a biotech company to try and help her.
Yes, I was happily at Sirius. My daughter was diagnosed with a generally fatal condition, pulmonary hypertension. There was no medicines approved, and now, several years later, I'm happy our company's got 4 medicines approved for this condition by the FDA. Thousands of patients are taking the medicines, and my daughter, thankfully, is alive, healthy, and working at our company, United Therapeutics.
Do you want to start with United Therapeutics and the prospect for that company as a whole, or just overall sort of XPRIZE type of futuristic?
Well, about 99% of what I know is about United Therapeutics.
Then we're going to talk about flying unmanned flying helicopters.
Yeah, I'd like to fly helicopters too, but United and jets.
But I thought you want to fly helicopters without pilots.
Well, we want to fly the helicopters with organs to save people's lives. One of the products in United Therapeutics' pipeline is replacement organs for people who have end-stage lung disease or end-stage kidney disease.
But these are not going to be autonomous helicopters, then?
Ultimately, I believe they will. The way the software is developing with things like the self-driving car, the next step will be the self-driving helicopter, and we already see this with drones, and even the U.S. military uses them in Afghanistan today.
Martine, the potential for where you're going, I think the number is something as 1 million people who die a year from end-stage organ failure. And
just in the U.S.
And you're working on the ability to actually create, at United Therapeutics, artificial organs that can save 1 million lives potentially per year.
Exactly. We're really proud of our partnership with Craig Venter's company, Synthetic Genomics. He discovered the human genome to manufacture organs in a way that anybody could have a kidney, a lung, a heart on demand when they needed it.
So, I mean, United Therapeutics, in terms of the potential portion of your business, right now your 4 products are driving your revenues today. I mean, the artificial organs could dwarf that potential.
Well, I think you have to, with a company, you got to look ahead, you got to look around the corner. Today, our business is all about pharmaceuticals, but in the 2020s, I think you're going to see a transition, just like there was from small molecules to biologics. We just got a biologic approved last year. In the 2020s, it's going to go from biologics to regenerative medicine, tissues, beyond cell therapy, and then whole organs. So our company is well positioned. We own the U.S. arm of what was the Dolly, the sheep company, the Roslin Institute. And I think we're well positioned in the 2020s to be a leader in manufactured organs.
Organs are obviously, they're not monoliths. You're not going to create a brain, probably. What's the easiest one to do? Can you do a kidney? Is there...
I think kidney's the low-hanging fruit here. Yeah. So
I can't imagine a liver. I can't imagine lungs.
All of them are readily doable. Oh,
really?
Yeah. Oh, yeah. In fact, have already been done and tested in baboons, which is a model for the human. So we have hearts at the NIH now. Our hearts last over 2 years in the baboons. So hearts are doing very well.
Still on target for $2 billion by the end of this decade?
Yes.
In revenues?
From our pharmaceutical business, we just crested $1.5 billion, and the pharmaceuticals are growing.
So do you use the stem cells from the recipient, or do you just try to overcome the rejection?
So there are multiple ways to go, and one way to go is to overcome the rejection by modifying the pig's genome so the pig will produce organs that are human-friendly, much the way in the past decade people used pig valves, heart valves, to help people. So now we've advanced that to the whole organ.
Valves are one thing.
But the next step that we're also working on is you can create what's called an inducible pluripotent stem cell. So you take a person's skin cell, you tune it back to being a stem cell, and then you redifferentiate it into the kidney type of cells or the lung type of cells, and that work is going on today.
It's interesting, though, to hear you talk about by the end of this decade and then the 2020s, and you're a publicly traded company. How hard is it to get investors excited about technologies that might still be a decade or more away?
Well, I think in general it's pretty difficult. Fortunately for us, we have the delightful blessing of having a robust, profitable pharmaceutical program. So the investors are very excited about our pharmaceutical business, which revenues and profits have grown in something like 11 out of the past 12 years and all of the past several years. So they're very excited about our current pharmaceuticals. There are some far-sighted investors that say, hey, I have a chance to get in on the the Amgen before it was Amgen, or get on Google before it was big.
You're really early on this, though.
Well, we definitely are early.
You're very early.
Yeah.
And Amgen was erythropoietin. It was just a molecule that, I mean, that's one molecule. And it did. It went from $1 a share to $1,000.
Yeah, but it was the first. It was really the first biologic.
I know.
And we're going to have.
How far off are you talking about a transplantable organ that would be commercially available? At least a decade, right?
No, I think it's less than a decade. We'll have the first transplantable organs in patients before the end of this decade, before the end of 2019. Then you allow time for FDA approval. So I would say, FDA approvable around 2023.
You're working with the best innovators in the world. Craig Venter is going to be joining us on the show in a little bit. Dean Kamen, working on even 3D printed organs. Yeah,
well, 3D printed scaffold for the organ, which is like kind of the skeleton of the organ. And then we cellularize that scaffold with the stem cells of the ultimate recipient. So there's absolutely no rejection whatsoever.
We got to go. You want to weigh in on the election? 10 seconds?
No.
No?
Smart woman. Figure an easy out.
For purposes of innovation, you have a candidate?
I focus on our shareholders, our company. My candidate is science.
Fair answer. Thank you.
Thank you.
Appreciate it.